Yes, welcome to this session. Welcome to this session. A nice session it is. A nice session it is. Connect to your code and answer and me see this over here. What's up here? Today is nice for everyone. It has been raining outside so much, but the afternoon is okay. Afternoon is okay. The afternoon is blazing fine. So today, after taking care of cancer and going through the stages that of cancer that you understand we went through, stage 0, stage 1, stage 2, stage 3, stage 4, and we saw stage 0 and stage 1 and 2. It can be treated. What we do at stage 0 and 1 is treatment. 0 and 1 is treatment. We saw there are some stages that have problems. The stages that have problems, we talked about them, and we came to a conclusion that taking care of cancer needs to start from the beginning, and it is important when you check out yourself and screen yourself, mostly when you have these cancer cells that can be activated in your family. We saw how cancer cells can be activated to mutate because of several things that people do for themselves, because of several things that we do for ourselves, like several things that we do for ourselves. We do several things like lifestyle, living a very bad lifestyle. We're living a lifestyle that you don't like, taking care of yourself. Alcohol, cigarette smoking, and also doing some things for yourself. Jamaican uncle said hi. Hi, Jamaican uncle. Thank you so much for coming to the session. Today we are going to talk about palliative care management of cancer. Palliative care management of cancer is a very important topic, and sometimes when people get cancer, and there is a question that I asked yesterday, that which stage do you think people get to the hospital? And some people said 3, some people said 4, some people said 2. Blessed love to Dr. Benjamin in the chat. Thank you so much for coming in. I've just started going through the topic, and welcome everyone who will be in the chat. And it's a good day. It's a good day that we go through some management skills, and we went through the stages from 1 to 4. We saw cancer can progress. We staged, and we did our here walking too. Okay, nice one. I really wish one day we have a collaboration between Jamaican uncle and Barry walking exercise. I know that will be a big collabo. That will be a very big collabo, and it will nice up everyone. It will really nice up everyone. So today I've started early, 2 minutes to my time, but it's okay when you come early, so that you can arrange your books well. You can let people come in as we continue. So Barry walking exercise. I really like Barry walking exercise. When he walks, talks, he has energy, talking around, interacting with people. You see, that is the real exercise that we really need. The real exercise that people need when they want to be healthy. You see, so in a way, in another way is there are some things in life that we should check on, because our topic was cancer, but people really told me we start with breast cancer, and we started with breast cancer, and you saw how it can be initiated. You saw how cancer can come in the family if you have that immunity problem in you. And the first thing that you really need to know where breast cancer starts from, the first thing that you really want to know where breast cancer starts from, breast cancer starts from one important point. Maybe in your immunity there is breast cancer cells, breast cancer gene cells, BRC, the factor that makes repairs breast cancer gene 1. We saw there is factors that continuously continue your cells when they are getting destroyed. They are very important factors in your body. Those are the most important things that make you not to have cancer. So we saw there is breast cancer gene 1 and breast cancer. Onik, welcome to the platform. Thank you so much for being here. My brother, Jamaican uncle, and everyone who is coming in. Majay B, welcome, Majay B. Today we will deal with palliative care and also answer some questions that will come up in the platform. So I was saying, before we start palliative care, there is something that is very important. There is something that is very important in the life of a person. In the life of a person, for you not to get cancer, there is something that is called breast cancer gene 1. Breast cancer gene 1, and then there is breast cancer gene 2. Breast cancer gene 2. They are very important factors in the life of a person. Breast cancer gene 1 and breast cancer 2. You know why? Because you are taking it every day. You are exposing yourself to factories, to toxins every time. But breast cancer gene 1 always repairs the dead DNAs to make sure they are working correctly. You see? And there is breast cancer gene 2. We talked about breast cancer gene 1 and breast cancer gene 2, and we saw how these factors help someone. So those are the most, wait a minute. And 2. Those are the factors that make some people to get breast cancer. They are the factors sometimes that make some people to get cancer of the breast. Because now, when maybe genetically you have that you're born with some mutations with this BRCA. Before I start palliative care, this is a very important point that I want people to Simplicate, Benjamin, and the entire crew in the building. Welcome. Thank you so much, Simplicate, to be here. Before I continue with palliative management, there is one point that I want everyone to understand. And this point is very important when it comes to cancers, especially breast cancer. Breast cancer gene 1 and breast cancer gene 2 are very important genes that help to protect the body from developing cancer. You understand? Understanding them is a very important thing. So, in breast cancer gene 1, they help a cell as it continuously exposed to some toxins. You get? When it helps a cell not to mutate, to start being cancer. So it repairs the cell. It does what? It repairs the cell. Then there is breast cancer gene 2. You know, gene 2 helps to make differentiation. Differentiation means a cell to do what it's supposed to do, not to do something that it was not supposed to do. You get? That is how people get breast cancer. Some people are born with a breast cancer gene 1 that is mutated. So it's not taking and repairing the genes well. And that's why you will see some people are born with mutated cells. Or some people, when they are born, the more they are exposed to some things, the more that they are exposed to some toxins and some elements in life, the more they get the Miss Marie, my daughter, you're here. I'm passing a very important point for women, because women, you have elevation of estrogen. Greetings, Benjamin, Dr. Dad. Welcome. So, mutation of breast cancer gene 1 and breast cancer gene 2 that repairs the dead cells, and the gene 2 which makes the differentiation process to be okay, is what makes people to have breast cancer. But you can avoid it in this way. If in your family you notice that we have that potentiality of having breast cancer, because maybe my aunt or my uncle or someone else had breast cancer, you will notice that if you have the finances, if you have the money, you can go you yourself, not for only screening, it is called immunotyping, to get these genetic makeups. You tell the hospital, I want immunotyping, and I want to know about my breast cancer levels gene 1 and breast cancer levels gene 2. You will do them, and the hospital will tell you you are okay. If you are okay, you know you are not really exposed. You are like 70 to 80% not exposed to getting this cancer. But when you say, they tell you now it is below 65% or 70%, you will know that your family line is getting breast cancer, because the most important features, breast cancer gene 1 and breast cancer gene 2, are at the low level on your side, or the same two genes have mutated. They are not doing the things that they are not. Rough cause of this could be, let me check on the hospital's portal, then I'll tell you. This is Simpocate. So, people get to hospital when, let me check for you just now, Simpocate. Of screening, you have asked the two of sorry. If you have any question, it's important you ask. When you ask, you say that I want to know more about it. It's not that you don't know, to know more about them. So this is the most important point that I'm putting out. This is the most important point that everyone who is listening, you should take home. And I repeat it. If you see one of your genetic line, your aunt, your mom, any person in your genetic line, if you are new today we talk about medical issues. Interact with the people who are at the chat. Don't forget to like and subscribe, so that if you have any question in future, we can interact and we can learn. So we can see around, let me see how many dollars these are. Okay, let me see, because we are a lot of people, and when you relate this to dollars, people get okay, Simpocate, the cost of doing these two is roughly from $232 to around $360. It depends with, that is around 30,000 to around 45 to 50,000. So that is the rough cost about screening that BRCA, around 250 to around. So worldwide, I've been told it's around 250 to around $5,000. It depends with the test you are doing again. Now that is the rough cost. But you see, even if I think it's not a cheap test, and even if it's not a cheap test, it's better you screen yourself, so that you know the potentiality of you getting it, so that you take care of yourself. Because if you don't have, you are a woman, your estrogen is high, and you don't have you have a mutated gene 1, it's not working as normal, it is not repairing your DNA. What will happen? You are prone to you are prone to getting breast cancer. You get, even for men, there are some men that their estrogen is so high. Their estrogen is so high. So it is important when you are following up and doing these tests, so that you if your genetic makeup, there are some people that have suffered from, you can avoid it early. So welcome everyone in the chat, welcome. I've been just going about the overview, and I've passed a very important point about how people get breast cancer, and that is very important to note. I can see Rogers Gilia, my brother, Bodonika, Miss Marie is here. I can see Simple Kate has asked a question. King Ray Judy is here. I've seen several. Majay B is here. Welcome. So yesterday we did about breast cancer, and it was a good topic. You remember, we did up to 4th stage. Imagine from 0 stage to 4th stage, and I asked a question: which stage do people get to the hospital? And people said stage 4. No, the stage that people get to the hospital is when they start getting pain, and that is late stage 2. Late stage 2, when it has gone through the ducts and affected at least one lymph node. Late stage 2, when it is getting to stage 3. And you see, once it has gotten to the lymph nodes, now that is where we have a serious time to treat these people, because the degree of getting to the body has gone so high. So palliative management. Today, a woman who has PCOS is prone to breast cancer. A woman who has polycystic ovarian syndrome is, let me say, when you have cysts are not cancerous, but there are some accumulations of thick fluid. Margaret in Norway, my sister, is here. My sister, I've passed a very important point. My sister, before I answer my JB, my sister is always very serious about health matters, screening herself, knowing how to live well without cancer. My sister Margaret in Norway. So I may say, I want to repeat it because of her. There is 2 genes. Let me repeat before I answer Margie. There are 2 genes in the life of a person. And Sumana, welcome to the chat. If you're coming in right now and you're a new person, here we talk about good morning, Sumana. It's evening here. We are talking about palliative management. Please like and don't forget to share. Share is very important. If you have not subscribed, anyone subscribe. So my sister Margaret in Norway, and the ones that are getting in now. The important point that I've passed on today is 2 genes, breast cancer gene 1 and breast cancer gene 2. There are some people who are born with, in their family, 1, it has mutated, or 2, it is low in levels. So when you have these levels that are not working correctly, it makes you prone to breast cancers. And you see, gene 1 repairs the dead or the mutated cells, and gene 2 makes in differentiation. So if you see your bloodline, there are some people that have breast cancers, please make sure you go to hospital and check your levels of breast cancer gene 1, breast gene 2, so that you can know how your condition is. And when you know your condition is this, you start avoiding things that are not supposed to be taken. There are so many people who take fried foods, and their breast cancer gene 1 and 2 are low. There are so many people who take alcohol, and they don't know these 2 things in their lives are low. And you see, it's not a cheaper test. If you are watching and coming in right now, please hit the like button, subscription, interact with the people that are in the chat. Don't forget to interact with the people that are in the chat. It's very important so that we form a good community. And even if you are new, it's good to tell us I'm new in this platform. Yeah, can I know 1, 2 to 3 people? It's very important. So there is another question that someone has asked. That is my friend who has asked is Marjay B. Marjay B has asked me, is it a woman who has polycystic PCOS are called polycystic ovarian syndrome, prone to cancer? And this is important, Marjay. I hope you are listening where you are. Listen. If you have polycystic ovarian syndrome, high chances you are secreting from your ovaries a lot of estrogen. You get high chances, and it increases androgens. Androgens is something called the steroids that your body produces. Steroids that your body produces. In PCOS, ovulation may not occur regularly. You see, it leads to prolonged estrogen without progesterone balance. And you remember what we talked about, long-term estrogen exposure is non-risk factor to breast cancer. And that's why we took and we remember what we said: estrogen receptor gene, progesterone receptor gene, and HER2, human epithelial growth factor 2. The 3 are the ones which determine which type of cancer, of breast cancer, that you have. So if you have polycystic ovarian syndrome, I will also for women, because polycystic ovarian syndrome is for women because they have ovaries. It means that there are so many cysts in the ovary. Ovaries in the cysts, I've said, is accumulation of fluids, thick fluids in the ovaries that cannot be, you don't have an explanation where they have come from. So you will have to go and do breast cancer gene 1 and gene 2 to find out if you have a good immunity to protect yourself from breast cancer. It's very important. But there are some indirect risk factors like obesity, insulin, and the metabolic syndrome. Those ones are, but when you have PCOS and your genetic line, someone had it, be careful because you can do. I hope Marjay, I've asked that question correctly. Marjay, it's important, very important to check those factors when you are having these problems. Now, today is a good day. It's a nice day. We have learned about breast cancer from stage 1 and we went up to 4. And we saw 4. The stage that 4 is those cancer have malignantly. They have spread. Malignancy is spread. The potentiality to spread. Miriam, greetings. Greetings, Miriam. Miriam always is here. Thank you so much for your support and always continuing to be my bigger sister. I thank you so much, Miriam, as you are in the platform and having even promoting my sister in Norway in her. We thank you, Miriam Mumbwa. Now, let's talk about stage 4 before we do palliative management. Stage 4, we talk about making life comfortable and making this patient having quality of life, but not treatment. Stage 4 of breast cancer, you've seen that it has metastasized, it has gone up to the bones. It has gone up to the bones. And if it has gone up to the bones, what can we do? We just try to make things better. And that's where we talk of palliative management. Palliative management focuses on improving quality of life for patients with serious illnesses. Improving quality of life with serious and supporting their family. Also, Ben, I always advocate to go for cancer screening. Some hospitals offer for free. Yes, Margaret in Norway. Some hospitals offer for free, mostly for cervical cancers. You get, for cervical cancers, you go, you do that is called the Viavili. screening with violet tests, and then you get it. It is important to be screened. Please listen to my sister Margaret in Norway. It is very important to be screened. Checking out everyone. If you are coming in, you are new, and you are wondering what we are doing here. We talk about medical issues. We sensitize about medical stuffs, and we interact and we give support mentally to those that need support. And if you have a problem, you need to be assisted, we are here. We can connect you to any doctor who is around where you are. We can find a good way to interact you with a doctor, to connect you with a doctor that can help you. So we were talking about breast cancer. We are in stage 4, where it has gone everywhere, and we have said it is not just end of life. It is not end of life. You know, a person who has stage 4, this person has family, and running stage 4 cancer, it entails multisectoral, because the family members also are involved, and it takes the family members time, and these family members think a lot how to manage this person. You get, it takes time, and also it takes some obvious things, you know, stress, people sitting there thinking on person will be. And you know, when people are reasoning like that, they think it is end of life. Very soon we're gonna lose our person. So palliative management, it has key factors: supporting the family members and improving the quality of life of the person that you have. So they are the principles of palliative management that I'll go through, like relief of pain and distress symptoms, affirm life and regarding dying as a normal person. You get it? Those are the principles. Holistic care, the whole person. Welcome Butterfly Island, welcome to the chat. Thank you for, I see you here. Thank you for being here. Holistic care. And then we have patient-centered care and family support. Interdisciplinary team is always there. This is the principles of palliative management. So palliative management is very important, because when we talk about relief of pain, a person who is in stage 4, you'll always know that the nerves are involved, and when the nerves and the skin is involved, you will always get pain. And getting pain means you need to relieve the pain. Sometimes they go out of breathlessness. You have to relieve the breathlessness by giving oxygen. Nausea and vomiting because of the drugs and the cancer that this person is going on. Fatigue, the body is tired because cancer cells, I told you, they use a lot of energy. Anxiety and depression. Why? Because these people, the family and the person who is sick, they are seeing end of life. There is nothing they can do now. Pain management follows the WHO pattern. Stepwise medication. We will learn about pain in management of pain when it comes. Is it quicker for a woman to have breast cancer than a man? And Dr. Y. Benjamin. Oh, it is quicker because most of the men have a hormone called testosterone, and that one is the one which defines a man. Breast cancer is clearly connected to estrogen elevation, because estrogen makes the breast cells to multiply so faster. So women have high amount of estrogen in them, and that is it makes them to be a woman, and that's why they are more prone to breast cancer than men. Men have low amount of estrogen. That is why. Now we continue. We will talk about WHO analgesic ladder progression when it comes to analgesia. I mean pain management when it comes to breast cancer. And then we have affirm life and regard dying as a normal process. Palliative care does not aim to hasten or postpone death. I want you to know that this is reality. It does not aim to fasten. Is it more likely to have breast cancer in older years than younger years? Yes, it is. It is. It is mostly when when you get older, some factors of immunity go down, and then some things like polycystic ovarian syndrome starts to form up, and those things make your estrogen to go up at times. So most of the people that are older may get breast cancer than most of the people that are young, and that's why you will not get most of the people that are young with breast cancers. They come at the ages of more than 25, 20, 30, they're going up. Yes. Okay, now we continue. This is an important topic when it comes to palliative care management. Affirm life and regarding dying as a normal process. This is what you should tell these people, the family plus the dying person, as a person who is taking care of the whole thing. Even if you are a doctor, if you are the caregiver, if you are you are the person who is taking care of this person, you have to tell them palliative care does not aim to hasten the death or postpone death. It does not. It helps the patient live as actively as possible until death. It makes the patient to live as actively as possible until death. And then we have a holistic care, whole person approach. The whole person approach. The whole person approach means care addresses several things. The whole person approach, like physical needs, pain and symptoms. Physical needs like pain and symptoms. Psychological needs, psychological needs, that is mental. Now you need to be talked to avoid fear and anxiety, because when you come to have fear and anxiety, you will die faster. And then spiritual needs, meaning beliefs and hope. Spiritual needs, that is what we call holistic care. You need spiritual needs, physical needs, which is to relieve pain and symptoms. You need psychological needs to avoid fear and anxiety. We have social needs. The social needs need family, finances, and support systems. And we have spiritual needs, meaning beliefs and hope. And then we have patient-centered care. As we take care of the family and this patient, there is patient-centered care. Respect the patient's values, wishes, and dignity. When a person is stage 4, we don't have much time. This is just taking care of what this patient needs. You respect the patient's needs, values, and dignity. If this person does not like being taken care of with a man, please don't force, because that person is the best in the village or the best in the hospital. Give this patient what this patient needs. The foods that the patient needs, give this patient what he needs. If this patient does not like going out or going to some places, don't take these patients there, because you know that this is the best hospital or this is the best clinic. Don't force the patient to go there. To improve quality of life, alleviate fear and anxiety. It is very important. So when it comes to patient care, involve them in decision making, and always make sure it is informed consent. Maintain privacy and autonomy. Don't just, when you have visitors, you have gone out, you start seeking sympathy because you are with this person. You want to tell every person, you see, this is my relative and this relative is undergoing cancer. Some people even come live on some platforms, and then they start saying that, please feel for me, my so and so has cancer. And everywhere, when this person goes out for a walk, everyone is telling this person, oh sorry, we had. No, always maintain privacy and autonomy. It's very important. This is called patient-centered care. We don't want anxiety and some issues that are coming out of. You get family support. Support extended to family and caregivers. Family support extended to family and caregivers. Include education, counseling, and bereavement support for the deaths. Get very important. Interdisciplinary team approach. Care is given by the team itself. Care is given by the team, not one person. Doctors, nurses, social workers, counselors, and spiritual leaders, plus the family members that this person has. So you don't just give care by you yourself. No. Interdisciplinary. This, I'm talking about the principles of management of a person who is under palliative management. It's very important to follow these things that I'm saying. And then there is early integration into care. Palliative care should be given early in the illness, just as terminal stages. You have gone to the hospital and they have told you that this patient of yours is in stage 4 and there is nothing you can do. The only thing we can do is continue the treatment that she is in or he is in, and then you should think of palliative management so fast. Stop postponing, because sometimes denial makes some people deteriorate so fast. When you deteriorate, you get into denial. That is the first thing you start getting. You deteriorate so fast, and then you start having issues with life. You start having issues with what? Life. This person dies earlier. Integrate this person to palliative management immediately. You are told this is palliative management. And then there is ethical practices. And ethical practices are practices that people are given when it comes to family and cultural practices. Respect patients' care. Do good. Beneficence. Always try to do good. Non-maleficent. Try not to do harm. Because some people may take advantage that this patient is sick and they start doing some harm to this patient. It's not good, because someone is down and has no justice, fair access to care. A patient is in stage 4 and this patient, because he's in stage 4, cannot access care as needed. You start taking prioritize the others that are not like this patient, because you are saying, some people say, here we are just wasting money, we don't have anyone here, we are waiting for the day. It is very bad to talk like that. Autonomy. Respect the patient's choice. Respect the patient's choice. Continuity care. Continuity of the care is very important. Continuity of the care is very important. Now, in palliative management of a bereaved person, I was just going through the principles of palliative management generally, but we have pain management, moderate and severe. We have stepwise. You start with the normal paracetamol, brufen, or weak opioids. Then we go to morphine. You always want to follow the step ladder choice that is there. You don't just give because this is a drug that can relieve pain. You start just giving drugs. No. Something like morphine is given at an advanced stage. But there are some people that are stage 4, but they are not in much pain. You get? They are not in much pain. So those ones you can give like paracetamol, or you can give something that can help like the normal ones that we buy over the counter, brufen or weak opioids. Let's go step by step so that we cannot undergo resistance and things that may make this person to deteriorate. Control of cancer. Yes. Sometimes internet can be a problem, especially when it's raining. It's raining this side, and there are some. It's been raining, and internet is bringing some issues. So we continue with the alleviating of pain. So pain, you should follow the steps that I've said. Thank you. That is simply Kate. Thank you for your thought. It's very important when we follow these issues. Control of cancer symptoms is very important. When you control cancer symptoms, you get this person gets better every time. Like oxygen therapy, there are some people who have even bought the oxygen tank and it is in the house. It is very important for them. Low opioid, e.g. morphine. Don't give more opioids. You know, when you give more opioids like prednisolone, you give more opioids like those morphines. Sometimes they reduce immunity, so the chances of this person living more, having some time of life reduces. It's always good to talk to your doctors and your practitioners, health practitioners, to know the choice of drug that you can give this patient, to know the choice of drug that you can give this patient. So the sitting position always when taking food upright, it's very important. I can see more new people getting in. So if you're getting in here, medical issues, if you have any question that you want to ask, don't fail to ask. The chat is open. You can ask any question that you have. Don't just listen. If you're not understanding anything, please ask. There are some nausea and vomiting drugs that help you when you feel like nauseated, and they are called antiemetics. Margin. Well said. The doctor is so compassionate. Oh, thanks a lot, Jamaican uncle. And we thank you for even having you when you are around. At times, you know, when I want to do some things, I have to consult, and I've always consulted. I have always consulted Jamaican uncle for some things, and he has guided me as my elder. Don't ask him here, how can I do? He's always there for me, and I call every time, despite the age, even midnight at times, and he picks. Thank you so much. You are very loving and caring doctor. That's why I connect to you so much. We have the same goal. Thank Dr. Benjamin. Welcome, Jamaican uncle. Thank you so much. So we are talking about nausea and vomiting. There are some drugs like metoclopramide. There are some drugs like aldosterone. They help to reduce the nausea. You know, when a person has, and you remember we said, a person who has cancer, the cancer cells are overworking, and if the cancer cells are overworking, this person needs more energy, and we went to the nutritional care. So if this person will continue vomiting, you know, they'll deteriorate the quality of life. You understand? So we need to alleviate nausea and vomiting. Fatigue, energy conversion, light activities is possible. Nutritional support is very important. So, my guys, there is a question that comes out when you are taking care of a cancer patient, and stage 4 mostly. People say that it's very expensive. Thank you so much, Mercy Grace, for tuning in. Thank you so much. People say that it's very expensive. What do you think about that? When we're talking of nutritional support, Dr. Benjamin, happy Saturday, Savior Man. Today we are dealing with palliative management of a person who is at stage 4, palliative management. So you that is a question that I've left for you to help me think. What do you think when people tell you that it is very expensive nutritionally? Then we're going to answer it at the end of the topic. Bone metastasis management. Bone metastasis management, very common in breast cancer. Pain relief. Anything that metastasizes and goes to the bone, it is very painful. So we have to talk to the doctors every time. And then there are some drugs that are called biophosphates, like zoledronic acid. Biophosphates, they increase the density of the bone. You get? And radiotherapy for bones, and radiotherapy for bones, and fractured bones. And that's why when Dr. Benjamin, I just joined. Thank you so much, Savior Man. Savior Man, you are always with me. Thank you for being here, Savior Man. That's why someone asked me, why do people who have cancer are in a lot of pain? When it goes to the later stage, which is stage 4, it becomes so painful and aggressive. And when it becomes so painful and aggressive, what happens? You start having bone pain. And the pain that is coming from the bone, the pain that comes from the bone is very painful. And that's why they are put in drugs like morphine. You see, so I've answered the question that you asked me about the stage that people get into hospital. I've said it is late stage 2 to stage 3. That is where some pain starts to happen, where some pain starts to come. And when pain starts to come, you know what? It brings on some problems, uncomfortability, and this is the time that people rush to hospital. And when it is stage 3 and it has gone to a lymph node, the chances of recoming after treatment is high. The chances of repeating after treatment is high. Jamaican Sunshine Food Vlogs, welcome. Oh, I remember you, Jamaican Sunshine Food Vlogs. I remember you. I remember Jamaican Sunshine Food Vlogs. You are here. I followed your channel and I saw you are cooking. Thank you so much for being here. If you have not subscribed, hit a subscription. I did message you. I did on one of your videos. It must be very painful. It's painful. It is painful, my friend. It's painful. And when it is painful, it needs to be taken care of and it needs to be corrected. So I subbed to you a long time ago. Thank you so much. I saw it. You subbed. I saw it. So we are talking about breast cancer today, and we are in stage 4, and we are taking palliative care management. So we continue with our stages, and we say that when it has gone to the bone, there is nothing we can do. We have to take the density of the bone, and we have to create the density of the bone to be hard. Because now, if we don't do that, this person will start having bone fractures. So pain alleviation, relief pain. We use some drugs like zoledronic acid. They are called biophosphates. They help to retain calcium in the bones to be strong. Radiotherapy for bone pain is important. So we do radiotherapy to reduce the bone pain and prevent fractures. I thank everyone that is here. If you are here and you are new, remember the subscription button is there and you can ask everyone. My friends, today we have a new person, Jamaican Sunshine Food Vlogs. She's here. She has a channel, by the way. She has a good channel. You can visit her so that you can leave some eggs and some subscriptions to her channel and follow her. She's my good friend. That is Jamaican Sunshine Food Vlogs. Now, we continue to brain metastasis. You may find that this thing has gone up to the brain. When it has gone up to the brain, steroids like dexamethasone can reduce the brain swelling, so that it cannot continue having the swelling in the brain. You get? It reduces intracranial pressure to reduce, and when it reduces ICP pressure, what happens? You start living well, you start having that comfortability because your pressure now is not going up. And we do something that is called radiotherapy. And then there is something that I want you to know, which is very important when it comes to cancer, and it has gone up to the brain. If the brain is affected, some people will start having seizures. Like a person who is epileptic. Seizures come because of the affected, because some people ask why she or he was not epileptic. But when we went to hospital after a few days, the person started to have seizures. It is because of the distraction. So as ladies and women are at risk, right? Yes, Miss Marie, I've said women are at a higher risk because of the high estrogen than men. Women are at risk because of high estrogen in their bodies, and you saw estrogen makes some cells in women to progress so fast, and that's why women are at risk. You get, Miss Marie? And before I continue again, I want to repeat, they are cute. Jessie is here. Cute Jessie, welcome. If you are a woman, I want you to listen to me carefully. For breast cancer, there are 2 genes that help you repair DNAs destroyed, and there are another one which help you to maintain something called differentiation, to make the cell to be where it is. Most of the genetic factors are the ones which make people to have breast cancer. Yes, so well, we all need exercise and eat. Yes. So the most important fact, when you see one of the person in your genetic line has breast cancer, if you can afford, go for screening yourself. Check if you have BRCA1, breast cancer gene 1, or breast cancer gene 2 that is at normal levels, because these ones are the ones which repairs the cells and the DNAs not to get to cancer. Very important topic and very important point to women and even men that have high estrogens. You get? Very important. Very important. Now, we have said we were on the topic of it has gone to the brain, and you are seeing your person is having metastasis. You get? You are seeing the person you are taking care of is having metastasis of the brain. It shows seizures. Sorry, this person is having seizures. This is where she or he is introduced to anti-seizures drugs that like valproate, carbamazepine, you understand, those drugs to help this person to have quality of life. And you know, seizures can make a person to go to stroke. So when it comes to brain swelling, steroids like dexamethasone, because when the brain is swelling, you will have so bad headaches. It is called raised intracranial pressure. You will have so bad headache. So you are given dexamethasone to reduce. Remember, we are just helping to at least help the quality of life. This is stage 4, and we are doing palliative management. What we are doing here is not treatment to heal. We left healing at stage 0 and 1 long time ago. Check that out. So, control of tumor. There are some tumors that we don't remove. So, because if you remove, oh, the network is so clear today. Oh, thank you, Savior Man. You know, it has been raining for some day, so the network was having a problem. Thank you for that. So we see your control of tumor is very important, because now this is a stage 4 cancer, patients of breast cancer, and it has metastasized up to the bone. Removing the tumor may not help, because even if you cut and remove the tumor, you will just give a wound that will not heal. then you will be giving this person another stress of a wound. And you, as a doctor or a medical practitioner, you will be giving yourself stress of a wound to get healed. Here in England, we are screening everything, I think, for breast cancer, but can be preventable. If so, how? Yes. Let me answer that question before I go to the next point. Butterfly Island. When we started, we said most of the breast cancer comes in genetic line. When you find out that you have a relative or previously a relative that baby had a breast cancer, I'm answering Butterfly Island 1. Here in England, listen to what she has said. If you have not gone to the chat and you're listening, please check out the chat. Here in England, we are screening every 3 years. I think for breast cancer, but can this be prevented? If so, how can we prevent from getting breast cancer? We say this, that most of these things come genetic, because you'll find some people in their family, they have breast cancers, but others they have never had. Breast cancer is controlled by some 2 genes, breast cancer gene 1 and breast cancer gene 2. So if your family, you are born by insufficiency of this gene or mutated gene 1, which repairs cells when they are destroyed, because we saw breast cancer starts from the cell, mutated cells, and you are born with cells that are mutating, mostly gene 1 and gene 2. Gene 2 is the one that helps in differentiation, making the cells to do what they are supposed to do. Gene 1 is the one which repairs the cells. When you have taken alcohol, you have smoked, you have eaten foods that have free radicals that destroy cells, gene 1 is the one which repairs those cells so that they cannot mutate to get. So for you to avoid, 1, go for screening. Get your genes taken correctly. And if you have low or mutated, if you want to avoid, you start avoiding things that you should not be taking. Exposure to chemicals in hospitals and in companies. When you go to visit, you avoid chemicals. You avoid foods that you are not supposed to be taking, because foods that will expose your body to free radicals are the ones that bring cancer. And you've seen it so well that one of the things that this thing do is the food that you eat, introducing free radicals to your body, and then they displace the genetic makeup, and then you start having proteins or genetic DNA line that is not well, and it is mutating now to other cells. So that is how we can avoid getting. You can have the genetic makeup of of low gene breast cancer gene 1 and breast cancer gene 2, but it doesn't mean that you will end up getting cancer. No. It means it's through your initiative. What you take, what you do, and what every time you are going through that will make you avoid these things. There are some people who have this genetic problem, but they have not got breast cancer because they take care of themselves. Butterfly Island, I think that one I tried to explain in the right way. Now we go to control of tumor growth. Control of tumor growth. Palliative treatment. Tumor growth, palliative treatment. Now, at stage 4, we cannot remove the tumor, because if we remove the tumor, we will be dealing with problems of the wound to heal. So, in stage 4, this is where we go to. In palliative care, treatment can slow disease. How can it slow the disease? Hormonal therapy. If estrogen receptor and protein receptors, you remember, the ones that control estrogen and the one that control progesterone. Dr. Benjamin, what are the foods and drinks avoid to prevent cancer? Yes, Savior man, we talked about that in our previous video, and you are the one who asked. So if I will refer you to that, and if we have time, we'll go through that question again. The previous video that we did, and we talked about nutrition in breast cancer, just previous, I think it was yesterday. It has explained everything. So even in palliative care, treatment can slow disease. We check hormonal therapy. Hormonal therapy, estrogen receptor gene and protein receptor gene that we talked about, when they are positive, we give hormonal therapy. Because if there is a estrogen receptor gene that is not working correctly, and then you find out that your estrogen is becoming so high, this is where we induce another receptor, a hormone like protein, to do something called negative feedback, to reduce this estrogen. Because if you give a person more progesterone, it is called negative feedback. Estrogen will be suppressed. Thank you so much, Margaret in Norway, my sister. This is a very important topic when it comes to palliative care. So that is how we do it. We check hormonal therapy and we balance it to the other one. Chemotherapy, low dose symptoms control. We give some chemo, some drugs that are chemo to suppress the cancer cells not to go on so faster, so that the tumor that is undergoing angiogenesis, you remember what we talked about angiogenesis. Angiogenesis is formation of the cells of the tumor, other blood vessels, to make it feed faster from nutrition and oxygen. So we give some chemotherapy to make it not to present so faster. You get? Then we have targeted therapy, e.g. human epidermal growth factor 2, epithelial cells growth factor 2. If it is positive in you, and you know human epidermal receptor growth factor 2 is the one which makes these cells to grow so faster. It is the one which makes these cells to grow so faster. So if this is the problem, what do? We target it by giving some drugs that are like tamoxifen. Tamoxifen is a drug that is given to reduce this human epidermal growth factor 2. Get? And then we take care of the wound, because it is stage 4 where the wound, the tumor is, it has affected even the skin. So you can see the wound itself. Regular cleaning and dressing, antibiotic if infected, because we don't want problems there. Guys, I'm watching but busy. Thank you, JHank47. Thank you for watching. Thank you for everything. So wound care is important, and that's where we do what? We do regular cleaning. And you know, wounds of a cancer patient, healing is not easy, because the cells have differentiated to other cells. They are not doing what is supposed to be doing, because now the skin cells are not skin cells. That's why you will find some cancer cells, some cancer patients, wound healing takes so long, and healing becomes a very tedious process. Then you control bleeding and odor. If you see there is pus, and so you can use hydrogen peroxide to reduce the pus. And even the odor itself, because you are a wound that is continuously open and you are dressing it causes bad smell. Then nutritional support we talked about, and this is the place that Saviourman was asking. We talked about nutritional support at a big level, but now nutritional support here is in another level. High protein diet, because you need bodybuilding foods. to make your body not to deteriorate so fast. Remember, the cancer cells have picked something called angiogenesis. They are a lot of other blood vessels by vasoendothelial growth factor. Vasoendothelial growth factor. So you give high protein, small frequent meals, because if you give a lot of meals at once, this person will vomit. So small meals to be absorbed little by little so that this person can be okay. Manage appetite loss by giving antiemetics and vitamins boosters. See, then we go to psychological and emotional support, counseling, offering support groups, family involvement. Don't just be busy every time you are working and your person is alone in the house. You don't have time. You only look at this person once when you go home at 11 at night p.m. You just find the person has been given food and is sleeping. You are there. You just say hi and go and sleep. Get some time for that person. It releases the pressure in the brain and the body tries to maintain itself by giving neurotransmitters like serotonin and dopamine, just by sitting around this person and trying to talk to this person. There are some people, mostly old age, they are left alone. You just send money not knowing how this person is. Please, let's try to be closer to people who are suffering, even if you are financially empowered and you think money can solve everything. Your presence is a very important thing to the life of this person. You get? So, my friends, stage 4 is a multi-sectoral stage. And you've seen some people living on stage 4 even for a year plus. Because of the multi-sectoral involvement, involving people, involving this, being there for this patient, following the right channels to help this person. Don't ignore these steps of palliative management. Psychological and emotional support is very important. Support groups, family involvement, counseling. Dr. Benjamin, in what age I need to check my prostate? Right now, Savior Man, you are my age mate right now. And you continue checking after every 6 months. Prostate antigen test for men. After this, we will be talking about the prostate for men. After this, we will be talking about prostate for men, especially those men that have problems with erectile dysfunction at an early stage of 35 and above. So we continue. Patient may experience anxiety, depression, fear, or death. This one is taken care of by the multi-sector, the family, the support groups, and counseling. But don't forget, we live in a world that we are in a spiritual world, and we have religions, and we need to have spiritual and social support. This person was a Muslim. Let the Muslim. Yes, Savior Man. That is an important age. Let the religious people come check this person. Spend time with this person. If you are a Christian, if you are a Muslim, Buddha, any religion, this person belongs to a spiritual or social group that was religious. Some people don't allow these people to be visited. It's very bad. Allow this person to be visited. Allow this person to interact. Let this person believe that my life is normal, but I'm undergoing this pressure in life. Involve social workers. If this person is okay, don't force this person. Get financial and home-based care planning. Financial and home-based care planning is very important. But let me ask you something, my friends. Have you ever tried to start creating end of life for a person? I know it's a very touching question, but guys, let me just ask. If you have ever, how did it go? How did it go? You personally, how did you feel? Who has ever, let's see from the good, who has ever tried to prepare? You have been taking care of a person, and then now you are taking care of end of life care. This is a very serious point, and sometimes it is very hard for people to start thinking of taking care of end of life. Who has ever done it? Here in the group, if you are listening, tell me, have you ever prepared someone for end of life care? Savior man, I am 38 now. Savior man, today you are quiet. End of life care, what does it entail? Because at stage 4, now we are talking about maintaining life up to end of life. In which way do we prepare end of life? Because it's stage 4, it has metastasized everywhere. We are taking care of several things, and now we are here at end of life. Tell me. End of life care is about maximizing comfort, dignity, and quality of life when a disease is no longer curable. You see that question, people cannot answer it because people are afraid of death. It's not an easy stage. True, Butterfly Island. It is not an easy stage, but the way we have said, this is a stage that we have accepted, and we are taking quality of life. We are taking quality of life. We are doing the quality of life. Just need tender loving and care. Yes, we are doing quality of life. So end of life care is about maximizing comfort, dignity, and quality of life when a disease is no longer curable. It is called part of palliative care. It is called part of palliative care. I see people popping out, popping in, popping out, popping in. If you are new here, we talk about medical issues, and we are talking about breast cancer. Blessings, doctor, and everyone. Beauty, welcome to the talk. Welcome to the talk. So if you are new, don't forget to subscribe. If you have a question, interact with the people at the chat. Queen CNLB, blessings family, happy Sunday, happy Saturday. So you see, in palliative management, this is a place that I worked for some time in a hospital in the elderly unit. Yes, and I know you saw what you saw. At elderly unit, palliative management, they are there. Cute Jesse 03N. Yes. So, my friends, focus entirely on comfort and avoid aggressive, unnecessary treatment at this age. Cause more harm than benefit. Reduce the quality of life. Giving more antibiotics, antivirals, they damage the liver and they reduce the quality of life. But painkillers, there is stepwise management of painkillers. Stepwise management. WHO, stepwise management. At end of stage, we have something left, stage 4. But when we have something left, the more you give drugs, the more the body deteriorates. You get? So we have reduced aggressive treatment. Examples often avoided are ICU admissions without clear benefits, repeated invasive tests of surgeries causing wounds, late-stage chemotherapy or radiotherapy unless for relieving symptoms like pain. Resuscitation is not aligned with the patient wish. You know, there are some people that have gone through cancer, they have accepted, and they want to resuscitate them every time. Every time you want to resuscitate them. No, if the patient does not need resuscitation, let the patient go in peace. Even if you love this patient, how much? Always we go with the patient's preference, prognosis, and quality of life. Hospice or home-based care. Care is usually shifted from hospital and more given near where the relatives are, or hospice, like the one Butterfly has said, elderly homes, so that you can go. Maybe you are so busy, all of you, and you just have some time to go visiting, and the professionals are doing their job. Home-based care. Patients stay home with family, supported by healthcare workers. You get? So there are so many things when it comes to palliative management, and I see some people are appreciating. Accepting this is stage 4, and we are just taking good care of the patient. We are taking good care of the patient as we wait. The day is very important. Communication, honest, compassionate discussions with patients and family is very important. Advanced care planning, respect the wishes of the patient. If the patient says, if I go into shock, don't resuscitate me, let me die, tell the doctors that. Family support of psychological and bereavement care. Even the family themselves, they need care. The people who are taking this care of this patient, we need to take care of them so that they cannot have depression after the person is gone, and after and even through taking care of the patient. I've seen some more people getting into depression when they are taking care of the patient in stage 4. Then the patient deteriorates because the family is not being given the advice they are needed. You see, always think of this. In stage 4, always prioritize comfort over cure. You listen to me? Always prioritize comfort over cure. Don't put cure first. Comfort. Because you know it is stage 4. Cure may not help. This is now where people now, I can see here say, sincerely may God be with you. Thank you so much. If you want to receive more spiritual nourishment, Queen CNLB does it so well. Please go follow Queen CNLB channel anytime you have time and you feel you need some spiritual nourishment and relaxation and feel that I want to rejuvenate spiritually. You will feel nice. So anyone with a problem, anyone who thinks you have a problem or a question on stage 4 and palliative management can ask. That is palliative management, and I've insisted that avoid aggressive unnecessary treatment. Comfort over cure is very important. Always make the patient comfortable. Because now, if you start thinking, when people take some people to hospital, whatever that is in their mouth is whatever that is in their mind is, let's get the best doctor to treat our person so that this person can heal. We have the finances, we need the best doctor, and that is where the problem comes. It is very sad. It is very sad. But Savior man, let me talk about this. God has programmed everyone's day, and you have to prepare for everyone that day. In this platform, anyone who is here and watching, anyone who has ever come across near-death experience, there is something we call near-death experience. My lecture one day talked about it, and some people said they have seen that. Or anyone who has experienced something called sleep paralysis. If you have ever experienced sleep paralysis, please tell me. And this lecturer was saying, he was an old lecturer, a very respected man, and he was saying he's had, Dr. Benjamin, get some water, no Coca-Cola. No, I've not eaten something through the day, and I've been busy from morning, so I need something to give me energy. That's why I'm taking Coca-Cola. I don't want to eat food. The near-death experience is it's like you are in your dreams and you are seeing your body lying there next to you. This is called near-death experience. It is normal in the life of people. Some people face near-death experience. Your soul and if you have ever been in this position, please tell us. Let us hear from you. Doctor, you and yours are in my prayers. Welcome so much. You see your body there lying, and you are here looking at your body. Near-death experience. But there is something that is called sleep paralysis. Now, sleep paralysis is this: you are sleeping, and you cannot move your body. You cannot turn your body. Even if someone calls you out, you cannot run. Even if someone comes there and wants to do something, you cannot run because your body is paralyzed. Sleep paralysis are normal. You tell me no one has ever experienced sleep paralysis? So I'm saying this: anyone who has experienced sleep paralysis or near-death experience, near-death experience is whereby you are in your own world sleeping, and your soul has come out. You are looking at your own body sleeping on the bed, and you can't shout. You feel like your soul or your heart is trapped somewhere. There are things that are happening out here, and I'm relating them to the wishes of a patient who is in stage 4. Stage 4. Everyone has got his or her day, be it 100 years, be it 40 years, be it 30 years, be it 20. God has given us life, and God has a purpose of everyone's life. The only thing that we need to do is to take good care of His temple. And taking good care of His temple is taking good care of our bodies, to avoid things that will destroy the temple of God, which is our bodies. So anyone, when you find a person is in, doctor, very scary. Yes, doctor, very scary. It is scary because, you are not exposed to this thing. You see death as a death sentence. So I'm trying to tell people, when you see someone is in this stage, you get, when you see, I have checked you out, watching your videos at the background and so on. Yes, Queen CNLB, you have an egg. Someone has given you an egg. That is simple, Kate. Now I'm saying it is important to prepare. Know that this is the outcome, and the outcome has no reversal. Let's take good care of this person. Let's take good care of quality of life and not cure. Cure, when it comes to stage 4, is not there. The only person who can dictate the cure of stage 4 is the one who created us. And who created us is God Himself. In dialysis, we experience a high death rate. Some live long on dialysis and some do not. We know that kidney failure can be terminal. Yes, kidney failure can be terminal, because now if you continue being cleared, it cannot be like the body itself programmed by God. So Queen CNLB, I know you are understanding what I'm saying. Preparation for end of day. So guys, now that Savior Man is saying I've started talking and things are being scary, let me not talk about scary things anymore. Let me talk now about everyone who has been in the platform. It is important to talk about such things because they help people. I was with some special and I can't multitask. It's okay, Jamaican uncle. It's okay, don't worry. It's important to talk about these things, and it's very important to go through end of life preparation. And you see, it is prepared after stage 4. So my people, knowledge alleviates fear. Yes, knowledge alleviates fear. Thank you so much for tuning in, and let's not get scared so much. These are normal things that happen, and knowledge helps us interact and get to know what next to do. So when you are there, please don't forget to share my channel to your friends. Don't just get your information alone. Please share this channel to your friends and tell them, we have feel good days, like feel good Fridays, feel good Wednesdays, when we come here and we do our thing. You see the doctor himself in another level. We interact, and I've seen people liking it so much. Feel good evening. They say it relieves their pressure. So guys, don't forget, when we have feel good evenings, to come there. We sing. We interact out of diseases. We create our mental health to be stable and to be nice. You get? But anyway, life is life. We should protect the life, and we should always make life to be better and better and better. Now, who is here who has any question before I leave? 5 minutes to go. Who is here who has any question? Any question that you have, my friends, any question that you have, I'll be waiting. You know, I've talked some things that have made people scared, and I don't like making people scared. I like making people understand the reality. So anyone who has a question, my friends. Yes, Queen, please. It is important because I saw on my email some emails that came. You are the best, Simple Kate. Thank you so much. I saw in my emails some emails that I'm not conversant with, and they was telling me, please continue doing what you are doing, because I did what I followed what advice, and I'm now okay. And some have been in doctors in and out, several emails. So if you know there is someone who is struggling with some issues, don't tell that person to share the platform. There are so many videos, and one day this person might come when we are discussing the real problem that person has, and that person will get help. So I'm just saying, if you have relatives, you have what, share them, share. Let's get a big community. And if you have a channel here, when you share this channel, yes, Hosea 4:6, my people are destroyed due to lack of knowledge. Please help us with this knowledge. Yes, if you share the channel and you have your own channel, the more we grow, the more you have a big community, even you yourself with sharing. And if you check out, I always, when I have some time and you are online, I will always come there anytime I have a chance, even if I'm working, and I will share your channel to some channels. I do that. If I see you in my, and you've seen there is a new, one of our friends that have come here is a new person from Jamaica, and I just shared her channel and followed to some channels, and you see they have started to find me. So share channels. Don't say what someone said. Savior man said, if you share if you go to share your channels, you'll be sharing your followers. Don't be selfish. Let's interact. Let's go together. So any question about palliative management or breast cancer itself? Any question about palliative management or breast cancer? Anyone who has a question about it? Palliative management or breast cancer? Who has any question? Or there is a topic anyone wants us to go through? There are some talks. Today I don't have feel good evening. Feel good evening is on Friday and some days in weekdays, like on Saturday, on Wednesdays and Tuesdays. Maybe there is a topic that you want us to talk about. I can come on at 10. That is how many hours from now? 6, 7, 8, 9, 10. 4 hours from now, I can come to online. We discuss that topic shortly before we rest. Anyone who has a question or a topic that you would like, or a question on breast cancer, you are invited before. Yes, doctor, you are the best. Thank you. I don't know if you have discussed cervical cancer and bone marrow. Oh no, but we are still we just that is Simple Kate. We started discussing cancer, and there was so much pressure about breast cancer, so we had to deviate from the normal. We do breast cancer, then we go back. But we have a day that we will discuss cervical cancer and bone marrow cancers. That one is coming, no worries. No worries about that. That one is coming. Many of my clients don't understand the brain function changes with dementia. Yes, it changes. The function changes with dementia. Okay, well noted. Thanks for that. So I can see no question today, and you don't want us to talk about anything after 4 hours. Anyone? Yes?
Patrick, people want Storanto. I know this is the bad news.
Compare antihypertensives. Eye problem like glaucoma. Oh, glaucoma, yes. You do this, eh? Mweke line akuja. And this is the third day. Anafaa kuanza antibiotics. Yes.
hizi masiku amekuja tukimosha.
Yes.
Inakwanga 1/6 sasa anasema mengi nimechunga itaenda chini.
No, it cannot. Yes, it cannot. Tell him I'm coming. But prepare, we reduce it. Eye problem like glaucoma. Yes, we will talk. That is under glaucoma. Butterfly Island is under ophthalmology. We will talk about ophthalmology when the time is coming. When the time is coming. So, my good friends, today we have had a very good session. Although Savior Man is saying it is so scary. It is so scary. Savior Man, that is life. We should talk about what is eating us. So, we have a good day, everyone. If I get any topic, we will go through it at that specific time that I've said. So have any good day wherever you are. Good night, good morning from those who are in the US. Have a good morning. We will meet. Bye-bye. See you later as we talk about the next topic. Bye.